Welcome back to Beyond the Clinic Walls, the podcast dedicated to helping healthcare companies thrive by leveraging technology and innovation. I'm your host, Roby Flynn, and today we're diving deep into the financial backbone of every successful practice profitability through expert management of insurance contracts, credentialing, and revenue cycle. I'm excited to introduce our guest today, Nathaniel, the CEO of NGA Healthcare, a specialized consulting firm based in Tucson, Arizona. They focus on helping medical practices significantly increase profitability. Nathaniel, thank you so much for joining us.
No, thank you, Roby.
Can you start by telling us a little bit about NGA Healthcare and the core services you provide to medical practices?
Absolutely. So we provide negotiation services, contract negotiation for a wide variety of medical practices and medical specialties. And why that's important is because it's something that is not often done on a continual basis and needs to be done continuously. So we have a team of 100 who represent thousands and thousands of physicians against insurance companies to ensure their reimbursement is equitable.
Right. What was your driving force behind establishing this company, such a specialized focus on the financial health practices?
Sure. So there are a lot of RCM companies out there and a lot of great ones. However, a lot of them don't specialize in negotiating reimbursement rates. So I noticed a trend about 13 years ago that a number of these medical practices and medical businesses were not negotiating their reimbursement rates and didn't know how to. So that's how we started. And we started specializing in negotiating those reimbursement rates. And in addition to that, we started hiring people who used to work at the health plans as contract negotiators to join our team. And so they understand the red tape, they understand the nuances of navigating the negotiation landscape within these pairs.
In terms of the insurance contract negotiations, many private practices, especially smaller ones, often feel like they're at a disadvantage when negotiating with large payers. What are the biggest mistakes you see practices make in this area, and how do these mistakes impact their profitability?
It's not necessarily that they don't have leverage, so to speak, because there is a large amount of consolidation within the healthcare landscape, and the payers are trying to avoid that. Whenever a practice thinks that, "Hey, I may not have any leverage, I shouldn't even bother negotiating," that's just absolutely not true. You should be negotiating, even if you are a single or solo physician practice, because the payers are trying to avoid that consolidation. So just by virtue of not actually taking the approach to negotiate, that's what I see as one of the giant pitfalls within our client base.
For private practices, what unique consideration or leverage points might they have when negotiating these contracts, given the high value services they provide?
You have to look at how you are saving the health plan money, right? So let's consider for a second if you are preventing emergency room presentations. We know that emergency room presentations are very, very costly, anywhere between $30,000 and $50,000, just depending, of course, on the case. So when you are conveying to the health plan what you are providing, even as a solo doc, if you can say, "Hey, I have prevented 5 patients from being admitted to either the hospital or the emergency room. And as a result, I've saved you, let's say, $200,000." That's something that you absolutely have to convey. And just because you're a solo doc does not mean that you can't be providing some sort of value added service to the health plan. In addition to that, whenever a physician group has a certain amount of concentration in a subspecialty, that's absolutely imperative that that gets conveyed as well, because we're trying to explain to the health plan, and we're trying to explain to people in lay terms what the value add that we are bringing to the network. And we have to remember that that is valuable to the health plan itself. And without these physicians in their network, they're not going to be able to provide services to these employer groups.
Going off of that, what is one actionable piece of advice you can give to a practice owner who feels overwhelmed by the prospect of renegotiating the insurance contract?
You have to hire an expert. That always helps. Certainly, you can do it on your own, but what you have to do is you have to reach out to the health plan itself. You have to get to the decision makers. You have to, I like to say, convey the right information to the right people. And when you do that, you're putting yourself in front of your competitors and saying, hey, I'm different and here's why. And that's what's most important.
Moving on to credentialing. It's often seen as a necessary evil, but it's truly the gateway to getting paid. What are the most common credentialing pitfalls that delay payments or prevent practices from billing for services, and how can practices avoid them?
So with credentialing, people tend to think that, once you're credentialed once, you're one and done, and that's not actually the case. What payers do is whenever you join a new practice is they say, well, we need you to credential. We need you to be added to our roster, and that takes time. And that is by design. If it takes you 3 months to become credentialed, well, those are 3 months in which the provider is not having to pay or is not paid rather by the insurance payer. And as a result, it's a savings to the insurance company. So that is the major pitfall whenever you're credentialing a provider. And what I typically recommend is whenever you are going to be credentialed or you're going to bring on a provider, that you ensure that it is done in a timely manner. And what I mean by that is don't just submit your credentialing applications and hope for the best. There has to be a follow up, a consistent follow up, in order to ensure that your credentialing application is in process, making sure that it gets done. You have to have a level of accountability. What we tend to find is sometimes some practices will submit a credentialing application, and this is where the pitfall is they expect it to get done. And what often happens is you get in contact with the payer and they say, well, we never received it. And now you have to start all over again. So, my biggest pitfall that I believe is with respect to credentialing is to ensure that you have to ensure that you are following up very, very consistently.
Okay. For growing practices, bringing on new physicians or expanding their service lines, what's the most efficient way to manage the credentialing process to minimize revenue delays?
You have to have somebody who is in charge of the credentialing process from the get go. And you have to ensure that you are not only, of course, doing the process, but in addition to that, documenting the back and forth communication between your practice and the payer. And the reason that that's very important is because oftentimes you will find that, as I was mentioning before, the payer will say, well, we didn't receive this app or it hasn't been in process. And if you have the paper trail, so to speak, to show them that, yes, in fact, we did actually submit this application and here it is, that's going to be very valuable to you. There are certain states, Arizona included, that have credentialing laws that have absolutely assisted us in holding that amount of accountability. But even without those credentialing laws, you still want to make sure that you have a paper trail and that you have proof of what you've submitted and what you've done. Who have you spoken to? Who have you submitted it to? The applications, of course, that sort of.
And how does effective credentialing directly impact a practice's revenue cycle and overall financial health?
If you can get a provider credentialed more quickly, then you're going to be able to submit claims for that provider in a quicker amount of time. So the revenue impact is pretty direct. Think about it this way. If you were to get a provider credentialed in 3 months versus 6 months, then you have an additional 3 months that you can obtain revenue for that provider. And again, it's by design. To delay it by the payers is going to mean that you're going to lose money. So in essence, you are paying a provider without collecting any revenue, and that can be a very, very costly mistake.
With the revenue cycle management being the overarching process, what are the key areas within the revenue cycle management where medical practices often leave money on the table without even realizing it?
Oftentimes, they are leaving money on the table but not ensuring that they are properly billing correctly. And what I mean by that is, of course, we have E&M codes, and you have to ensure that you, of course, are billing properly. That's most important. You have to make sure that you are being good with regard to that. However, that doesn't mean that you shouldn't be able to properly uh, put together the medical records so that you are billing at the most appropriate code at a higher EN if possible. If you're spending an inordinate amount of time with a patient, then that should absolutely be considered. And you should really look at that and really become educated as to how you should bill correctly. Because I I can tell you that I have seen this many times that a medical practice will be actually underbilling rather than billing appropriately. And that's not good.
No, that's surprising. So, how do you approach optimizing a practice's RCM, and what kind of results can practices expect when they implement the best practices in this area?
I really believe that they should be negotiating their reimbursement rates. That's first and foremost. Of course, we mentioned the appropriate billing, and that is absolutely important. But in addition to that, sure that you are negotiating those reimbursement rates is very impactful. And the reason for that is because it hits your bottom line without having to spend any additional. That's why it's so important to focus on.
What role does technology and potentially AI play in the modern RCM strategies? Are there any tools that significantly enhance efficiency and accuracy that you've seen?
We've seen a lot of AI that is patient facing, so to speak, and that is helping with the RCM management of overdue patient balances, things of that nature. And I certainly would like to see more of that. And I'll give you a good example of this is that I went to the dermatologist and the day prior, I had received a bill for a patient balance that I owed. And I showed up at my dermatologist appointment and there was no mention of my balance due. And the problem with that is that, you know, patients tend to, and people in general tend to, forget to pay things, or maybe it, takes time, or maybe you got to log into a portal and that sort of thing. So whenever we can get AI involved to help with that and alleviate that, that's going to be very impactful for practices.
Yeah, that's actually one of the things I'm working on within my company right now as well. Like leveraging AI to automate a lot of these processes to improve the patient experience.
Yeah.
Beyond just increasing profitability, how does a finely tuned financial operation driven by expert negotiation and RCM impact a practice's ability to invest in patient care, new technologies, and even the well being of their staff?
Several possibilities are available when that happens. You can not only invest in ancillary services, you can invest in well-established experts who can help you with your practice. You can market more. So anytime that you have more profitability, it allows you to do those things.
What's your vision for the future of financial management in these medical practices? And we kind of already touched on this, but do you see AI playing an even bigger role in automating these complex processes?
I do. I see, and we've heard it from our many of our clients that they're starting to have virtual medical assistants that are AI driven. They are doing the intake of these patients. They're doing it with the front office staff. They're doing it with even the clinical staff. And we're going to see more of that, not just in this industry, but other industries as well. So we have to be very mindful of that. Is it ever going to replace a physician? I don't think so. You still need the human touch. You still need the expertise of somebody who has done dozens of years of training to get to where they are. And that's what I envision for the future.
I would agree. I think in terms of healthcare, laboring, there's so many jobs out there. I just truly don't think AI would ever have the capability of ever touching. It's a model that works off of predictability, and there's just too much. There's too many X factors there. But going forward, what's one piece of advice you would offer to private practice leaders who want to take control of their financial destiny and ensure maximum profitability?
And ensure that they are negotiating the reimbursement rates. Number one. And number two, ensure they're negotiating the reimbursement rates. But in addition to that, see what your competitors are making. And we certainly provide that to a number of our clients where we show them, hey, you're 20% below your competitors. You really should be negotiating your reimbursement rates. Think about it this way. Inflation is 5% a year, which is a conservative estimate, and you haven't negotiated in 3 years, then you are 15% below what you're making 3 years ago. And that's very impactful for a medical business.
Great. This has been an incredibly insightful conversation, Nathaniel. Thank you for shedding light on how critical expert financial management is for the health of any private practice. And for our listeners who want to learn more about your company or connect with you, where is a good place for them to do so?
You can go to ngahealthcare.com. You can email me, Nathaniel at ngahealthcare.com. We have a large team of people who are more than happy to create these benchmarks for you and show you what you're making with respect to your competitors. And we are more than happy to help. Whether you decide to work with us or do it on your own or work with somebody else, we just want to relay the idea that you do negotiate your reimbursement rates on a consistent basis.
Well, thank you again for your time and sharing this invaluable expertise on Beyond the Clinic Walls. And we'll catch you on the next episode.
Thank you, Roby.